World Health Organization has advised countries to prepare as the Omicron COVID variant poses a very high global risk. The new variant is expected to spread internationally after emerging in South Africa and could have severe consequences. No deaths, though, have been linked to it. Research is underway to better understand Omicron and its potential to escape protection against immunity induced by vaccines. So joining me now from the World Health Organization is Dr Margaret Harris. Doctor, thanks for your time this evening, your time. What's the latest information that you have on the power of Omicron?
Good morning to you. Yes, actually the very high global risk that you refer to is actually the risk assessment for SARS-CoV-2, all strains of it. So what that is referring to is just advice to countries saying the risk remains very high. So it's not specific to Omicron, but it has been a little bit misunderstood.
Okay, well, as for Omicron, though, what's your data on that? What's the latest information that you specifically have on Omicron?
So what we know at the moment is that there's a great deal more that we need to know. And you've already mentioned the critical things are, can it escape the current levels of immunity that we've generated by vaccines? And also, how transmissible is it? We know that in South Africa, it's certainly associated with some big clusters and big rises in numbers. And we know it's outcompeted Delta in some areas as well. So that gives us rise for concern, but we don't know whether it causes more severe disease or not. We don't know if it's putting more people in hospital. And those are the things that we're working very closely, particularly with the South Africans, who really should be given a medal for their science.
Sorry, I was just going to say, shouldn't South Africa's low vaccination numbers also account for the higher numbers of infections at the moment?
So it's not quite the same because we're seeing very, very high numbers of infections, for instance, in the UK. In fact, worldwide, the UK is second to the US for its numbers. No, I should say Germany is. But the UK has got one of the highest vaccination coverages in the world. They've also got some of the highest case numbers because Delta is very good at causing mild disease and transmitting itself even if you're vaccinated. The vaccines are just holding up against Delta, putting you in hospital.
Right. So there had been doctors out of South Africa yesterday who did refer to Omicron as a milder version. I mean, are you putting much credence into that?
So it's early days yet. And one of the important things to understand there is several of the big clusters occurred in young adults, in university students. So that's a group that no matter what version of this virus you have, that group tends to have the milder illness, quite often the asymptomatic illnesses. So that doesn't really tell us anything different. We need to find out a lot more.
Okay. Is it enough of a reason to close borders at the moment?
Certainly, we don't like to see that level of restriction because that really punishes, and it's particularly punishing a country, as I said, they should get a gold medal for their science and their transparency. And it makes other countries sort of less comfortable about being so helpful to the rest of the world. But it just isolates a country. Now, if a country does decide, looking at its epidemiology, looking at its health system, that it wants to delay the arrival or wants to take this very drastic approach, it needs to use that time to really get the surveillance going, the tracking and tracing, and get the community ready to accept the measures you need to use to stop the spread.
So you don't have any trouble with countries such as Australia, and others have done it too, to press pause on international arrivals, a portion of international arrivals for 2 weeks to buy time?
We'd like to see, actually, we would prefer not to see that level of restriction. I think the Secretary General of the UN put it very well, that he was very concerned about the isolation that's imposing on Southern Africa.
Okay. But I mean, governments, if they do that, is that a knee-jerk reaction given what's happened in the past, i.e. Delta?
So governments are taking these decisions based on what they think is best for their populations. But as I said before, if you're going to do that, if you're going to be so drastic, use that time very, very well. Get your health systems ready, get everything going, and don't do it for very long.
So too early to know, Margaret, if a new vaccine is going to be required?
Again, that's the work that's going on right now. And to look at, do they need to be tweaked? I mean, all these vaccines work on the spike protein, particularly the messenger RNA vaccines. And it's in the spike protein that we're seeing many, many more mutations in this one than we've seen in previous strains. So that's one of the very big questions we need to answer as quickly as possible.
Okay, Dr Margaret Harris, thanks as always for your time. Appreciate it. We'll talk to you again soon.